Good afternoon, everybody. Thank you for joining us. Um, we are happy to have you for our hypertension and cardiovascular disease echo series. I am Kathleen. I'm the program coordinator for the Constellation Regional Collaborative. If I haven't met all of you, but I think I've met everybody, so nice to see everybody again. Just a quick little agenda. We're going to start with introductions, and then today we have our didactic presentation and excuse me, a review by Miss Tammie Collins, the executive director of the Anderson Free Clinic in Anderson, South Carolina. Right after that, we'll have some questions and discussions for her. I'll let you guys know what's going on with the next session. Closing comments, and then we'll have our post-echo survey, which Nikita, I think I didn't get it to pop up in the beginning this time. I think I got it fixed, so it should pop up at the end. So I think I got that fixed for us. So I'd like to first start by asking our participants to please put your name, employer or organization, and your position or credentials into the chat just so we can keep track of you guys. And then I'd like to go ahead and introduce our subject matter experts and have you just say hi and a little bit about yourself. So I'll go with the Hollywood squares. Dr. Bretler, you're my first on my square, so if you want to go first, please.
All right, I'm supposed to say something funny though, being a square, but I don't have
Yeah.
anything prepared. So, anyways, Jeff Bredler, nice to be here and see all of you. I'm an internist from Los Angeles. I help co-lead the Kaiser Permanente Southern California region with their hypertension program, work at our medical school there, and also for PAHO as a consultant. I'm delighted to be here.
Thank you, Jeff. Emily, you're my next person.
Hi, everyone. Glad to see you today. I'm Emily Ridley. I'm a clinical pharmacist based out of an internal medicine residency clinic within Prisma Health in Columbia, South Carolina, where we serve primarily low income, both urban and rural population of patients. So I've worked within our health system and quality improvement efforts regarding hypertension control. Glad
Great.
to be
Thank
here.
you so much. Thank you, Emily. We're happy to have you. And Dr. DePetty, you're next.
Well, thank you, Kathleen, and welcome everybody. Don DePetty, as Jeff, I'm a general internist, the health sciences distinguished professor here at the University of South Carolina and University of South Carolina School of Medicine. I've dedicated most of my academic career to hypertension and cardiovascular risk factors. And also, as Jeff, I'm an advisor to the Pan American Health Organization. And as a disclaimer, I'm on the board of directors of Constellation as well.
Thank you, Dr. DePetty. We're happy to have you. Okay. So now I'll do a little introduction of our presenter. Ms. Tammie Collins serves as the executive director of the Anderson Free Clinic in Anderson, South Carolina. She assumed this role in September 2017, bringing with her a wealth of experience from her previous position at the United Way of Anderson County. An alumna of Columbia College in South Carolina, Collins has dedicated her career to community health and nonprofit leadership. Her commitment to providing accessible healthcare services has been instrumental in advancing the clinic's mission to serve uninsured and underserved populations in the region. We're so happy to have you, Tammie.
Good afternoon. It's good to be here. I have to set the record straight for my USC folks. My blood runs garnet. The shirt I have on is not orange. We're very, very specific. This is tangerine. Those of us that are Gamecocks, we are allergic to orange. So I needed to set that record straight at the beginning for my fellow Gamecocks out there. But I'm happy to be here and want to, first of all, kind of take you back to Genesis. The clinic has been around now 41 years. It started out of the mills that were closing in the upstate of South Carolina. We're up near Greenville. To give folks that aren't familiar with South Carolina, we're 2 hours from Atlanta, 2 hours from Charlotte. They call our area Charlanta. We've got a lot of tech companies here now, automotive companies, those kinds of things. But 40 years ago, the mills closed down. The mill workers were left with no health care. So it started with a group of volunteers. One of those volunteers, one of our founders, is still on our board and still involved every day with us, which is great. But for this program, how it really started was there were two folks here in town, retired family medicine doc and our retired hospital CEO, that were very interested in bringing the Blue Zone project to Anderson. And if you're not familiar, researcher determined areas across the world where folks were living to 100 and above and living well, and identified the commonalities and came up with these 9 tenets of the Blue Zone, and then is working to bring more cities into the Blue Zone project. Well, we were starting that process here, and COVID hit. So everything, came to a halt. Well, I was at our state conference. I think it was 21, and the director of the Hilton Head Clinic, I've got to give him credit. He's talking about his wellness initiative and this hydroponic farm, and I mean, the lights just kept going off. So I came back to my board. I said, listen, we got to investigate this, because we've already got some interest through Blue Zone, and maybe this is our baby steps to bringing some kind of initiative like that to Anderson. So we started with the picture on the left. It was our first hydroponic farm, and we planted it full of lettuce. And from the time we started the farm till we harvested the lettuce was about a month. We harvested 144 heads of lettuce, and we're so excited. And we knew this was a great start into taking a more proactive approach with our patients' health. And our goal was to make this something that's replicable. So, if another clinic wanted to do it, or say the YMCA in your area or something like that, we wanted to really boil this down to the basics and why. We have seen, just in 1 year, we saw our hypertension rates go from about 53% to 46%, which is a big jump for us in 1 year. Our patient population are folks that are 18 or older, live in Anderson County, and have no other insurance. Income guidelines, we're at 250% of the federal poverty guideline. So it's a very generous amount. Right now, we've got about 700 patients. We're part of the State Association of Free Clinics and the National Association of Free Clinics, and proud to be part of that group. So as you can see on those other 2 slides, that's lettuce taking over our little hydroponic farms. We have 4 now. And if you want to go to the next slide, Kathleen. What is unique about it is Hilton Head and our clinic are the 2 in the state that are doing this. And because many of our folks live in food deserts, our community health assessment, we have a huge population that are in food deserts, and many of which are our patients. So to tell them to go eat kale, if they can't even get to a grocery store, trying to get them to eat kale and quinoa and things like that aren't really doable. So what if we bring it to them instead? And then we saw the need to how to bring this full circle. So it's great to have this fresh produce, but what else do you need? So we pulled together our medical staff, our mental health folks, a registered dietitian, and we are offering more than just the food, because you can give somebody a spaghetti squash, but if they've never seen it, don't know what to do with it, it kind of is worthless. So we wanted to take it further. So we have got cooking classes every other week. We've got a cooking class using some of the ingredients in our wellness market. We provide our recipes, other cooking supplies, and everything is done in English and in Spanish. We've got a growing Spanish-speaking population here. And so we felt the need to not do it just in English, but in both languages. So it's great. So our next slide tells you about our wellness market intake. Because if we cannot, as you know, if we can't prove the numbers, it's not, it's a great project, but it's not doing much. So this is our tracking form that patients, when they first come to the market, they fill this out. We're on Epic. That's our EMR, thanks to our local hospital. They brought us in on Epic. So we're tracking our patients. And every time then, once they filled out this form the first time, every other visit after that, they just sign in. So we're tracking not only their health needs, but how many visits they make to the market and how often those visits are. And as I pointed out, we partner with Clemson University on our healthy and cooking classes. And we have Anderson University here. They also help us with some of our tracking, and it's a great partnership. And next slide. So one of the things that we learned very quickly, because we are a free clinic and we depend on volunteer providers every day, it's a different team of doctors and nurses, nurse practitioners that are here. So getting the word out to the whole team. So again, we take a holistic approach. Everybody will come if you feed them, right? So we try to regularly host a provider luncheon. This was the one we did most recently, and very well received. If they're in the know, they can then promote it when they're seeing patients and help complete that circle. And the other picture is just a picture of one of our recipes that are available to patients. We try to keep it simple. Doesn't take a gourmet chef to figure out, and it uses ingredients that if it's not something they get from our market, they can easily come across. So, and next slide. So here is our market. And one of the things that I learned from John at Hilton Head is be very careful and very intentional in making sure folks know this is not a food bank, it's not a food pantry, but a curated list of what we consider to be nutrient dense foods. So we've got pinto beans and red beans and black beans and lentils and quinoa and whole oats, peanut butter that does not have any sugar, which is hard to find. We've got flaxseed and things like that. And they're in more of a sample size. So it's not food that's meant to feed the family for a week, but a sample size with the recipes. That's what's hanging in front there, our recipes for folks to try. So next slide is another picture of the market. Just kind of a straight on, but we also, as you can see, we also have tuna that's in water. Sometimes we'll have canned chicken in water. Almonds, peanuts are some of the nuts we usually carry, and we get those with no salt. And it's taken a while for some of our folks to warm up to the idea of no salt. But once they've tried it, generally they're hooked. So that's good. And just one more picture of the market is on the next slide. So lots of information for folks on both the banners. When we're out in the community, we'll take one of the banners with us. And we are able to supply the market thanks to donations from folks in our community. We've got churches and different organizations that help supply us this summer as folks are planting their gardens and have excess. We get a lot of that. Folks that raise chickens, we get a lot of eggs from local folks that raise chickens, which is great. And another thing to point out about the market for us, it's not a free help yourself kind of market. We have a staff member, there's a team of us, and one of us will always be there to cover the market. And we, well, what you hear people call as personal shoppers, we do the shopping for them. And we're talking through each of the food items, asking them questions, what their likes and dislikes are, what their family might like or dislike. And it helps us to get to know our patients too, and we can gear things for them and their likes. And the next slide is our list of items that we try to keep stocked in the market. And as you can see, our wish list and a list of our suppliers. But the key is the results we're seeing. One of the patients not too long ago talked to, she had already lost 10 pounds. And another one has been able to lower her A1C and other numbers. So that's the why behind all of it. If we're not helping them with their health, it's just a nice, fun little program. But the goal is to see positive health results out of it, and try to introduce folks to more plant-based eating. And our cooking classes are geared towards a plant-based diet, not exclusively. Obviously, we've got the tuna or chicken in there, but trying to encourage folks to limit those meals to 1 or 2 a week, if possible. And it's just been really exciting for us to see it grow, and the thought of it being able to be replicated in any other kind of, not necessarily just a clinic setting, but other settings. So that's what we're doing in little old Anderson, South Carolina with our patients. And I'm open for questions. There's our contact form. There's our farms, where we get our farms.
That's perfect.
Tammie, this is Don giving you a holler. I'm sure you're well aware of it, and please tell me, yes, we know. There's a program that started here in Columbia, and now it's statewide. I don't know if it gets up to Anderson or not. I've lost a little track, called Food Share.
Yes.
And they're doing very similar. They have cooking classes, etc. And I don't know if there's a collaboration, or they're not in Anderson, or if they are. Maybe those would be likely collaborators as well. And then I will shamelessly let everybody know, including yourself, that Constellation Quality Health has recently, over the last 5-6 years, started a foundation. It's still under their old branding, CCME. And please consider submitting an application to the CCME Foundation. There are similar programs that have been funded. It's only in South Carolina and North Carolina. That's a paid political announcement for our foundation.
We partner really closely with our food share folks. AIM, our Anderson Interfaith Ministries, is the ones that oversee food share, and we partner very closely. And we have just launched Live Well Anderson. And so we're both really key partners in that program too. So yeah, we work very closely with them, and we have most of our market this past year and our registered dietitian all came through our grant through CCME. So we are very, very grateful.
Well, that's wonderful, Tammie. So you've been I should have known that, because I'm the past chair, the founding chair of the foundation, but nevertheless, thank you for reminding me.
Yes.
Remember, it's open for reapplications.
Very appreciative. Any other questions?
Hi,
Questions, comments?
I have a question actually. Hi, I'm Erica. I'm sorry I was off. I ran to grab something real quick, so I apologize if you already answered this. But you said you fill out the questionnaire so that you can follow the patients and see what their habits are, if they've increased their amount of fruits and vegetables. Do you have, I know you said they fill that out initially, and then do you ask those same questions every time they come? Or
We
like,
don't
where's
ask,
the end on that?
we don't ask the same questions. They fill it out initially. We then through Epic, they sign in. So we're tracking all of that for them through Epic. So they just have to do that initially. And then we go in and track, okay, it's been 3 months. They've been to the market 3 times. Where is their A1C? Where is, their blood pressure readings and those kinds of things.
Okay.
So
So
we're
then
doing,
like those subjective things like how do you consider your overall health?
we have not, we are in the process of doing a pre and post formal survey. We actually just talked about it yesterday, with the help of one of our university partners and helping them helping us put together pre and post.
I think this is fabulous. I'm gonna look into grants for something similar. I don't know how, like, maybe I'll call you. I don't know. I don't know how we would initiate it, or where, but I think it's a great idea. I love it.
We were able to, our local community foundation paid for our first farm. And from there, once people saw it, what we did with that first harvest of lettuce, we had a giant fundraiser here in town, our Festival of Trees. And so the lettuce from our farm is what we served as part of that luncheon. And then we put information on all the tables. So we got the word out quick, and it's just taken off like fire.
That's cool. I think I saw this Freight Farms, which was kind of like a similar thing. I got a bag from it where they did it with all like I get, all containers, shipping container things, which was something similar. It was hydroponic as well.
Yeah.
There's tons out there. It's cool. I have to
Yeah.
answer this question really quickly, but thank you. I
Yes.
appreciate you answering that.
Thank you. So in our farms, we have 4 or 5 different lettuces we're growing right now, arugula and kale. We're also growing, we keep constant basil, cilantro, dill, parsley. And then we experimented with cucumbers and tomatoes. We've decided with our climate, it's better to do those outside than a farm. So we've transplanted those outside. And peppers, we're growing peppers in one of the farms right now. Like I said, we've got 4. And so the goal is to always have product ready to be harvested. And so we've always got lettuce growing in. And our patients say it's better than any lettuce they get at the grocery store because basically we cut it that morning, put it in a bag, and they walk out the door with it. So they love it.
I have a question. When the patients are coming in, I know that you said that you're hooked into Epic. So you actually have your logins. So are you taking their blood pressure and that sort of thing while they're here?
We're not, but we've got their charts. So we can go in at any point at any time and pull up each patient and track them that way. And our Epic reporting team can pull different reports for us, whatever the constraints we want, they can pull that for us. So as we're working at continued funding, that's where the funding is going to come, is in the numbers that we can show the success. So yeah.
Perfect. Thank you.
I have a question. Do you find that you're mostly reaching individuals or families, or what's your demographics about who you're reaching?
It's families.
Families.
Yes, and we just see adults 18 and over, but their family members are invited to also come to the cooking classes. Information, we did a dementia class yesterday, and so that's open to patients plus their families. And
Yeah, I'm just wondering if you're, if it's trying, to get rid of the generational issues, and try to teach young children, through their families and their parents' experiences, towards better eating.
yes, what we're seeing is mother-daughter teams, um, and we've got several of those that come to our cooking classes regularly, and
It's
it's
a great
interesting.
bonding. Yeah.
Yeah. And then one of our patients was just saying they've been shopping the market, so to speak, they probably started with the market probably a year ago. And she was sharing the transition that her kids have made, because at first, they snubbed their noses at whatever she would bring home from the market and try. But she said the kids have made that shift too, which is great to hear.
Yeah, I mean, people pay money to get these bonding experiences, like painting classes and cooking classes. It's great. I think it's a great strategy to,
Yeah,
again, break that generational ignorance.
right, right.
Mm.
Well, and it helps too. We offer a lot of services here. We are, a basic medical office, primary care office, but we also do dental and vision, and we do mental health, and we do PT, women's health services, all out of our little clinic. And so when you've got all of those opportunities to introduce healthier, proactive practices, that's why we love the full circle. Everybody is in the loop on what's going on, and plugging patients in.
Such good work, Tammie. Congratulations.
Thank you. We're super excited about it. I'll even wear an orange shirt.
Tammie, this is Emily Ridley. I just had a quick question for you. This is fantastic. I loved hearing all about this. I'm always interested in the data end of things because we have challenges ourselves. We're in Epic, but even pulling data, do you guys use like a registry for those in Epic or such for identifying those patients who've gotten enrolled? I know you said IT had built some reports for you guys, but
Yeah, I call the Epic team. They just ran a report for me 2 weeks ago for another project. But I call them, I tell them the parameters that I need, and they run it for us.
okay.
At
I
this,
didn't know if,
as
I'm
we
sorry.
as we continue to grow, I'm sure they're gonna want to train me in how to do that rather than me bothering them all the time. But at this point, they're willing to pull those reports for us, so that's
Okay.
great.
I didn't know if there was a particular way that you had to flag people who came through in Epic, so then IT pulls from that group or,
All of our providers put in notes, including our registered dietitian, and so everybody's got access and puts in notes. Their forms are all uploaded under the Media Manager tab. All their forms are uploaded, and then of course just your good old basic Excel sheet helps us if we need a quick number. But when we want larger reports, bigger picture, I give Epic the parameters, our Epic team, and they'll pull that report for me.
thanks.
Yeah.
I have another question. I'm sorry. I'm just so excited about this. It's amazing. It really is. But and you may have said it. How many patients approximately do you think that you have right now?
We've got about 700 right now. And for us, one of our bigger challenges right now is making sure we have enough resources for our growing Spanish-speaking population. In 2022, we had about 8%, 9%. And then in 23, we jumped up to, I think we were about 19%. And this last year, we were 34% Spanish speaking. So that's one of our challenges, and making sure that everything we offer, we can offer in both languages. So we've got a special Spanish only cooking class. Our English speakers are welcome to sit in, but it will be led by a Spanish speaking instructor rather than English speaker, and then we interpret. This will be strictly in Spanish. So we're excited about that. That's coming up.
Hey,
That is so
Tammie, I
neat.
have another question too. Sorry, Kathleen, did you? Oh, okay. Do you, the successes are obvious, but are there any, if you're going to be advising somebody, I know I heard, I think Erica saying that she was interested in starting something like this. If you were advising someone, is there a couple of pitfalls that you know now to avoid?
Well, what we recommend is to start small. And we spent a lot of time with John in Hilton Head, went down, he came up and visited with us and saw our site. We went down there and saw his production, he's got 16 farms right now. We've got 4. So finding space, for us, I wanted it visible. I wanted patients to see, I wanted our volunteers to see, I wanted our providers to see and ask questions. So finding the space for it, you need about 7 feet when you open the wings, as they call it. But it's on wheels. And so first thing, get the farm and kind of learn the quirks of the farm. It's very easy. The company that we work with is out of, I think it's Minnesota, Fork Farms, and they've been so helpful, held our hand through every step of the way. Any questions, they were so quick to answer and so helpful. And so we had our farm and planted. From the time we got our farm till we harvested our first harvest of lettuce was 6 weeks, which was amazing. Amazing. Yeah. It's beautiful lettuce. It's beautiful. So to answer your question, I think one of the first things is making sure folks are aware. Getting all of our dots connected is what's been the key between all the services we provide and making sure patients understand what it is.
Yeah, well, having that picture, I mean, that picture that you showed in your lobby, I guess, or
Yeah, that's
Yeah.
We're a 2-story building, and downstairs is where the market is, and it's where our pharmacy is.
Mhm.
So anytime anybody comes to pick up medicine, what's great about it is sometimes it's a patient's mother or sister or neighbor coming to pick up. So not only is the patient hearing about it, but so are some of those folks that are part of their safety net are finding out about it too. So our other 2 farms are in our waiting room upstairs, where we do medical, dental, mental health, vision, women's health. Those are all upstairs. So 2 are up there in that waiting room and 2 down here in our pharmacy lobby. So our most trafficked areas.
Now, do the patients have to be referred to you to be able to use that farm, or say I was to come in with my mother was, say, referred to you, and I wanted to be a patient also. Are they able to do that?
Yes. Yes.
Okay.
We have little green tickets. I didn't put them in the presentation, but we call them green tickets. And when they check out upstairs, at the checkout desk, they'll give them a green ticket for a free visit to the market. Well, everything's free. There's no charge, but if they think they're getting something free, they might be more inclined to, well, okay, well, what's this about? And so they would come in just kind of nervous about, they gave me this, I don't know what it's for. So it helped get patients aware of what was happening and what it was about. So
That's great.
yeah.
Hey, listen,
Thank
if I'm
you.
hogging, don't just like mute me, Kathleen. But I just find this fascinating. Are there regulatory agencies? I mean, I know that there's like a lot of FDA kind of issues about like eggs and milk and like, do you have like regulatory agencies that you have to abide by their rules and have surveys or something with these farms?
That's interesting. We didn't to start. We did follow our Department of Agriculture's guidelines, especially for eggs. But we are in the process of becoming a member of our regional food bank. And so we just went through inspection with them. And as long as we are not selling our produce, um, we don't have as many guidelines that we have to follow, although we follow them regardless, but we're not required to. So.
That's great. Anybody else have any questions or comments?
No, this is Nikita from North Central Family Medicine. We're hoping to partner with someone, with an organization that has the potential of having food as medicine type model, the same thing here. And we're really excited. We're still in the meeting phase, and seeing how that's going to actually work to help us better serve our patients in the area. So just hearing that was starting to get my hair standing up saying, you know what, somebody else is doing it. So I probably will be looking into Anderson Free Clinic I hope you got a lot of information on your website so I can go in and look to help support this opportunity that we possibly may have in helping to better serve our patients.
We're part of the Food as Medicine program here in South Carolina. We were at their conference back in the fall in Columbia. And, that's the thing. If we can be proactive, so many things that we all deal with. I'm as guilty as any of our patients in not eating as healthy as I could. So the more we can encourage our folks to be proactive in that, and truly, food is medicine.
Yeah, I was trying to call when you gave out the stats about the 53%, you saw a decrease is down to like 46%. I was trying to call my registered dietitian and get her to come over here and sit in on the call.
Anytime. Reach out on the last frame of the presentation is our contact information. Mine and Sarah Donald is our coordinator for the program. And Sarah came to us from Clemson. She was a SNAP Ed teacher and she was leading cooking classes here. And we had an opening and I was able to steal her from Clemson. So I'm very glad about that. Again, the Gamecock is very glad about that. But she has taken over the whole wellness program, has just gone gangbusters with it. So outside we have a raised bed garden outside that two medical students built for us as their class project probably 6 years ago, and that's still there. We use it every year. We expanded it this year and doing some other planting outside to supplement what we're growing inside. So it's been something that's been on our radar and it just continues to expand. So we're excited about that.
On a sadder note, we had an organization called Victory Garden. They had, have you heard of them?
Have.
Yeah, so they had a place in the city. The city allowed them to use a plot of land, and they used it for about 2 years. And so now they're getting booted out of the way for a pickleball court. And damn pickleball. But they started doing hydroponic gardening, and so they were getting very popular with it. They had a senior cooking class at the local community center, but now they're having to move, and unfortunately they're closing their doors, but they're still going to be around in the community. But it's just sad to see them go, because they were here in the community for about 2.5 years, and it did make an impact, and it gave some of our seniors something to do, to be able to get out and garden and cook the food that they grew and stuff like that.
Mm-hmm. Mm-hmm. Yeah. We partner, we've got a network of community gardens here in Anderson. So when somebody's got more tomatoes than they know what to do with, we get the word out and share across the agencies here in town, which is really nice.
That's great. Does anybody else have any other questions or comments for Miss Tammie? Okay. Well, Tammie, we just want to say thank you so very much for your presentation, and you've filled our hearts with love. Honestly, we are so excited to have something like this and to learn all about your clinic. So thank you so much.
Thank you. Whatever we can do, any information anybody wants. We made a lot of mistakes, so hopefully we can help you not make those same mistakes if you're interested.
And I will go ahead and share out those slides at the end of the session, so that way you'll have all the contact information for Miss Tammie and the site, if you have any questions for her, and then later on.
Great.
So next we'll have our case review reminder. So just so you remember, we are always looking for cases to review. A lot of our echoes, we've combined our cases into the presentations. But if you do ever have a case that you would like to present, we have our template, if it is a patient case, that you can fill out through RedCap, just so the protected health information is nice and safe in case it does get put in there. And our next echo session is going to be Thursday, May 22nd from 12 to 1. The case review and the didactic presentation will be by Katie Wynn of the South Carolina Quit Line. And she'll be presenting tobacco treatment services for cardiovascular and pulmonary rehab patients. So very excited to have her come and talk to us about this. And the post-echo survey. So I did get it so it populates at the end. So once I end the echo meeting this time, it will go ahead and pop up for you. And it's that 8-question survey. I really appreciate the fact that you guys have been filling out those survey questions and giving us feedback. That is just helping us to improve the sessions and helping us to get echo. So it'll be more beneficial to everybody who participates. So thank you very much. There is that short answer that is optional at the end with any suggestions that you have. So please, good, bad, we want to hear them, because that's the only way that we're going to know what we're doing good and what we're doing bad and what we can fix. So thank you so much. And I will ask, are there any questions or comments before we end today? Dr. DePetti, you look like you're getting ready to say something. Oh, okay. Okay, you took your glasses off. I thought maybe,
Well, thank you, Kathleen. And Tammie, it was absolutely fantastic. And congratulations and kudos to what you're doing.
Thank you very much. We're super excited about it.
And Kathleen, it's just coincidence or not, but also maybe where there's possible connections with the Jackson, Mississippi group that's doing the Dollar General program that we've heard about recently, as well as what we just were introduced to with the Elm from the USC students here, bringing food, et cetera, down to elementary students. Anyway, just a thought.
Oh, that was popping in my head well, Miss Tammie was talking. Yep, I was already gonna get ready to send her an email, but thank you so much, Dr. DePetty. Yes, definitely.
You're welcome. There's a lot going on. And again, like everything else, we're seeing them being done in silos. And boy, the collaboration, or if we make this a community of, if a community of food as medicine, or a community of just like-minded individuals, I think it would be exponential.
Absolutely. Absolutely. Yes.
And that's why I brought up Food Share. Food Share started as an itty bitty baby thing, but about $10,000, and now it's all across the state. But it was a labor of love, and it was not easy. It took hard work and time, but it's apparently been successful.
Yes, and you did bring up Food Share, and just so everybody knows, we will be having Food Share. I believe they are June or July. They are our didactic presentators. So very excited for the upcoming presentations this year. So super excited. So we're going to go ahead and give you a few minutes back today. On behalf of the Regional Collaborative team and all of Constellation Quality Health and everybody who's here, we just want to say thank you so very much for attending. And if you have any questions or comments, please feel free to reach out to us.